ഹലോ ഫ്രണ്ട്സ്, എല്ലാവർക്കും നമസ്കാരം. പുതിയൊരു വീഡിയോയിലേക്ക് ഏവർക്കും സ്വാഗതം. ഇന്നത്തെ നമ്മുടെ ഫസ്റ്റ് ക്വസ്റ്റ്യൻ, early symptoms of aspirin poisoning are dash. Here the correct answer, option E, ringing in the ears or tinnitus and blurred vision. Earliest symptoms of acute aspirin poisoning may include ringing in the ears or tinnitus and impaired hearing. More clinical significant signs and symptoms include rapid breathing or hyperventilation, vomiting, dehydration, fever, double vision, and feeling faint. Intravenous injection of sodium bicarbonate is given in this significant aspirin overdose. It enhances elimination of aspirin in the urine. Acetyl salicylic acid or aspirin is a most commonly used analgesic, antipyretic and anti-inflammatory drug. The anti-inflammatory effect of aspirin are mediated by the inhibition of cyclooxygenase enzymes with the subsequent decrease of prostaglandin synthesis. Aspirin is a non-steroidal anti-inflammatory drug used to reduce fever and relieve mild to moderate pain from conditions such as muscle ache, toothache, common cold and headache. It may also used to reduce pain and swelling in conditions such as arthritis. Aspirin also has antiplatelet action. It prevents blood cells called platelets from clumping together to form a clot. Next question, which of the following is not true about infliximab? Which of the following is not true about infliximab? What is infliximab? Infliximab is a medication used to treat a number of autoimmune diseases. These include Crohn's disease, ulcerative colitis, rheumatoid arthritis, ankylosing spondylitis, psoriasis and psoriatic arthritis. Here the question is, which of the following is not true about infliximab? Here the correct answer, Il1 blocker. Here Il1 blocker means interleukin 1 blocker. Interleukins are a group of cytokines. It is a secreted protein in response to infection. It is synthesized by white blood cells, that is lymphocyte, monocyte and macrophages. They play an important key role in the regulation of the immune system. Here next question, a disease modifying drug in rheumatoid arthritis. Options are, first option gold preparations, second option hydroxychloroquine, third option methotrexate, D all the above. Here the correct answer, option A, B and C are correct. These are the drugs used in the treatment of rheumatoid arthritis. Here what do you mean rheumatoid arthritis? It is a diseased condition, a chronic progressive disease causing inflammation in the joints and resulting in painful deformity and immobility, especially in the fingers, wrist, feet and ankles. Then what are disease modifying drugs? These are drugs especially used in rheumatoid arthritis that suppress our body's immune and inflammatory responses caused by overactive or abnormal immune responses. These two systems responsible for the progression of rheumatoid arthritis. In general, they inhibit these T cells and B cells of our immune. Here T cells and B cells, these are lymphocytes, work together to recognize foreign substances called antigens as the primary agents responsible for adaptive immunity. Activated T lymphocytes are type of white blood cells that destroy pathogens via cell-mediated response, and activated B cells that produces antibodies. The most common conventional disease-modifying anti-rheumatoid drugs are methotrexate, sulfasalazine, hydroxychloroquine and leflunomide. Next question, a patient who is admitted to the emergency room with an initial diagnosis. Option A, slow ventricular response using verapamil. Option B, start lidocaine infusion. Option C, considered anticoagulation with warfarin. Option D, option A and C. Here the correct answer option D, that is option A and C. Slow ventricular response using verapamil and considered anticoagulation with warfarin. Next question, which of the following is true about surgical prophylaxis? Which of the following is true about surgical prophylaxis? Here option A, it is given to treat a surgery associated infection. Option B, it is given to reduce possibility of surgical site infection. Option C, should always be given regardless type of surgery. Option D, should be continued for 7 days after surgery. Here the correct answer, option B, it is given to reduce the possibility of surgical site infection. Prophylactic is a medication or a treatment designed and used to prevent a disease from occurring. Surgical antibiotic prophylaxis is defined as the use of antibiotic to prevent infection at the surgical site. Next question, when diagnosis of diabetic to be considered? Option A, WBC count with differential. Option B, oral glucose tolerance test. Option C, HbA1c. Option D, option B and C. Here the correct answer option D, that is option B and C, that is oral glucose tolerance test and HbA1c. The oral glucose tolerance test measures the body's ability to use a type of sugar called glucose that is the body's main source of energy. An oral glucose tolerance test can be used to diagnose pre-diabetes and diabetes. An OGTT is most commonly done to check for diabetes that occurs with pregnancy. That is called gestational diabetes. Here HbA1c is our average blood glucose level for the last 2 to 3 months. A normal A1c level is below 5.7%. A level of 5.7% to 6.4% indicate pre-diabetes and a level of 6.5% or more indicate diabetes. The increased level of A1c that also increases the risk for developing type 2 diabetes. This test does not require any fasting or other special preparation beforehand and can be done at any time of the day. Next question, the usual daily dose of phentoin in the range of dash. Here the correct answer, usual daily dose of phentoin is option C, that is 300 to 600 mg. What is a phentoin and what is its use? Phentoin is a synthetic compound related to hydantoin, used as an anticonvulsant in the treatment of epilepsy. Phenytoin is used to control seizure or convulsions in the treatment of epilepsy. It is also used to prevent and treat seizures that occurs during brain surgery. This medicine is an anticonvulsant that works in the brain tissues to stop seizures.